Ready? All right, here we go. Ready?
Yeah.
All right.
So I actually don't think that I would be here if it wasn't for tennis, oddly.
Hardcourt, clay, or grass?
Hardcourt.
Why?
Because I don't move well.
Great answer. Hello and welcome to Offscript. Here at Oswego Health, we like to take you behind the scenes of the healthcare team that takes care of you. Today, we are honored to have Dr. Andrew Rogall with us. Dr. Rogall, welcome.
Yeah, thanks for having me. I appreciate you having me here.
This is going to be so much fun.
Yeah.
Let me set the table for you.
Okay.
I'm going to ask you one question, and then we're going to see where the conversation takes us.
Sure.
At the end, I'm going to ask you some rapid fire questions.
Okay.
Are you ready to go off script?
I'm ready. Let's go.
Let's go off script. My first question, tell me a little bit about where you're from, your specialty, and how long you've been at Oswego Health.
Okay. So I'm originally from Kingston, Ontario, just north of the border here. It's, depending on the weather, 2 hours from here. On a good day at the border, it might be a little bit longer. I am a primary care physician, and I've been here since November of 2019. So I started right before the pandemic.
Cool. So I want to start with Kingston, Ontario.
Okay.
I have a lot of friends that routinely vacation in Kingston, Ontario.
Okay.
I want to know why. What makes Kingston so special?
Well, it depends on the time of year. This time is not great. It's all limestone and surrounded by water. So it can just be gray and kind of dull at this time of year. But spring, summer, and fall, it's absolutely fantastic. It's beautiful on the water. They've always got something going on, like downtown over the summer, whether it's like the Buskers or if it's Blues Fest. There's always something family oriented. The food is incredible. The last time I checked, they have the most restaurants per capita in the country, which is mainly because of the size of the city and the size of the university that we have there. But there's just a lot to do. It's laid back, family oriented. It's just a great place to be. 3 seasons out of the year.
As a winter guy, I'd probably like to go there now.
Yeah, you might like it.
Your favorite restaurant in Kingston?
Wooden Heads. Get the Marco Polo if you ever go. It is a wood-fired pizza with lemon chicken on it and sun-dried tomatoes.
That's
amazing.
my kind of place.
It's fantastic.
I see you brought some Timbits.
I did.
So tell me a little bit about, again, Canada and food.
Well, this is a staple. Maybe not Timbits being a staple, but Tim Hortons is a staple for sure. Like any other Canadian, I grew up playing hockey. On the way to any hockey practice, any hockey game, on the way to a tournament, every road trip started with a stop at Tim Hortons. And now living where I live, just 10 minutes away from a Tim Hortons, I'm there every morning on my way to work with my mobile order put in. And I've got my Tim Hortons to start every day, basically.
Awesome. Since you opened it up,
Yep.
Tell me a little bit about Dr. Rogall as a kid.
So I feel like I was the typical like 80s, 90s Canadian kid. A lot of hockey to start off. And I played hockey from the time I was 5 to maybe 20. At time for 2 or 3 teams. I have an older brother that's 3 years older than me. So we never were really on the same team aside from 1 year. So it was pretty busy for my parents. I mean, we'd be in tournaments in different cities through different parts of the years. But that was like one of the greatest memories I have growing up. That's where I met most of my friends that I'm still friends with today. And I wouldn't change that for anything. Later on, when I was around 13 years old, I got big into tennis. And then I actually did that as a career, worked at a tennis club from the time that I was 13 to the time that I was 28, before I went to medical school. So that ended up being a big part of growing up too. But other than that, like in the summer, it was, you're out the door by 8 in the morning and you're back when the street lights come on. It was a different time, but yeah, it's amazing. I loved growing up where I grew up.
Cool. Tennis
Yeah.
to being a physician. Tell
Yeah.
me how that was the transition.
So I actually don't think that I would be here if it wasn't for tennis, oddly. So I played a little bit in my teens heading into my 20s, but really loved coaching and teaching and working with people, which I think was a nice transition to what I'm doing now. And the people that I was always most excited or looking forward to seeing were the doctors that were coming from the university and the hospital that were just down the street from the tennis club. They'd come over, they were taking lessons from me, and hearing about what they were doing day to day was really something that caught my interest and made me think, maybe tennis isn't for me for the rest of my life. And I was just so interested in doing this. It's really what inspired me to do it. So if it oddly wasn't for tennis, I don't think I'd be here.
I want to dive a little deeper into tennis and how it transitions to being a good primary care physician.
Yeah.
What do you see that molds together between the two?
There's a lot of attention to detail in both. Although I would say medicine's a team sport, you're certainly out there on your own playing tennis, unless you're playing doubles. But I think you learn a lot of lessons of getting over adversity, finding ways, if you're playing somebody who's particularly tough and your normal strategy is not working, adapting and trying to find ways to use your strengths or their weaknesses against them. Kind of mirrors how we're going to get things done in kind of a challenging medical environment at times. If we're talking about like insurance prior authorizations, high copays, high deductibles, and just finding creative ways to actually get the patient what they need.
Awesome. So why did you choose primary care?
I mean, it's got a little bit of everything. So I was really between like, do I want to do surgery or primary care? I love doing procedures. I also love seeing people in the hospital and taking care of people and doing like their screening and managing their day-to-day complications. And I think the only thing that really encompasses all that's primary care.
Perfect. So for those who are listening, please tell me about the importance of primary care.
Yeah, I mean, I think it's called that obviously for a reason. I mean, we are the primary doctors that kind of coordinate care between us and specialists should a patient need to see them. But the primary care goal really is to try and prevent illness instead of reacting to illness. Mm-hmm. So we favor prevention more than treatment. Mm-hmm. We are certainly obviously able to treat a whole host of things: high blood pressure, diabetes, congestive heart failure, heart disease, COPD, all of that stuff. But our goal is to try and work on things that the patient can change with our help to try and avoid any of that from ever becoming an issue. And I think while that's not easy to do, it's easier to do that than try and undo things once things have happened. And the importance of keeping a healthy population and a happy population really kind of comes down to prevention and early intervention. And I think that's really our bread and butter.
Awesome. Back to procedures.
Okay.
What's your favorite procedure?
Oh, I don't know. There's a lot of them. As gross as it sounds, I think all of us love INDing an abscess and opening that up. It's like instant relief for the patient. They'll feel better when they walk out your door, as opposed to some other things that might take a little bit of time to set in. I love doing injections, whether it's trigger finger, carpal tunnel syndrome, arthritis of the knee, the shoulder. I love doing that orthopedic type of procedure. We'll remove cysts. I mean, we really do a lot, but I would say the instant relief of treating an abscess.
Is that why we love Dr. Pimple Popper?
Yeah, it's fascinating. Who doesn't really love that show?
It's a great show.
Even if it's gross. I mean, it's amazing.
Oh, that's awesome. What's one thing that you wish more people understood about primary care?
The big thing with primary care is that we're not just a referral center. We're not a place to come in order to just get a referral to a specialist. There's a lot of times where prior to ever seeing a specialist, we can manage those illnesses, again, whether it's like asthma, COPD, congestive heart failure, type 2 diabetes. I mean, those don't all need to see specialists. And if we were to do those referrals, there's a lot of stuff that we can handle right off the bat where that's what the specialist would do anyway. So I would much rather just get started with the treatment in primary care instead of referring out and just making more and more appointments for people, which we can handle in office. So really continuity of care, and we have a pretty broad scope. I think that's what I want people to realize the most.
All right, we're going to transition a little bit
to
Oswego Health.
Okay.
So first question, what originally brought you to Oswego Health?
Well, proximity at first. I was in Louisiana for the last part of medical school and for residency. I wanted to be up closer to home. I'm, depending on the day, 2 hours from home here. So having the proximity to family was nice. And in all honesty, when I came up here to interview, I was working with a recruiter, and the idea was that I was going to go to a different system to the west of us. And I was more familiar with that system. It's still relatively close to home. And the recruiter had said to me, I've got this other opportunity while you're going to be up here. You might as well go see Oswego Health since it's an hour drive away. So I came here and I noticed there was a stark difference between where I'd interviewed just the day before and coming here, where the clinic that I was interviewing for wasn't the one that I was initially told I was going to be interviewing for. They had kind of scaled back the procedures that were being done in office. And when I had asked, are we going to be able to get that back? It was really kind of a non-committal answer. I just didn't get a great feel for it. When I came here the following day, it was completely opposite. You could see that this system was growing. They were wanting to advance what they were doing. Anything that would help the providers give better care to the patients and to the community, they were all for it. And there was just so much more opportunity here than at other places I had interviewed.
As a new primary care patient to Oswego Health, describe to them what Oswego Health is.
Yeah, we're a system that really cares about providing really high quality evidence-based care to our patients. We've done, I think, a great job at expanding our service lines. And just to mention a few, we've recently added pulmonology we already had a strong cardiology practice, gastroenterology, orthopedic surgery, and the list goes on and on. And I think really what we excel at here is providing very high quality patient care in a very relaxed setting and also in a timely manner too.
How would you describe the connection between Oswego Health and the community you serve?
I mean, they're all about community. It's like the whole thing that Oswego Health bases itself off of is caring for our community here. And they've put so much effort into recruiting new specialties, new service lines to help take care of people here in the community without having to move down to Onondaga County or to northern New York, or sometimes even down towards like Auburn and into that area. So the ability to care for people here and keep people in the community, I think is huge. I mean, the community is what this is all about.
You mentioned team
Yeah.
when you're talking about tennis and healthcare. Tell me about how you feel team with a whole larger system. What's the advantages of being a part of the healthcare system?
Yeah, I mean, I think that's actually the benefit that we have in being a smaller healthcare system, is that in a bigger healthcare system, whether you're an APP, you're a physician, or you're a patient, you can't help but become a number. If I want to get in touch with somebody that's in the higher level of administration when I'm in a bigger system, like that's almost impossible to do. Here, those people are reaching out to me like weekly. You have contact with the executive team. You have contact with all the specialists. Everybody's just a text or a phone call away. The benefit that has is when it comes to patient care, we get stuff done quick. And that's what we can offer people that I think the other bigger healthcare systems can't, is that with the team atmosphere that we have, if a specialist needs to get somebody in with me for a pre-procedural clearance or a surgical risk evaluation, I mean, I'm a call away and I'll have them in within the next day or two. Conversely, if I'm seeing somebody who has a new complication of a chronic illness and I need to get them into a specialist and it's something that we have, again, it's a call away and I'm able to get the patient in. In fact, Dr. Grady, our cardiologist, reached out to me yesterday morning. And I've got a patient that's seeing him this week. So that's something that really, I think, sets us apart from all the other systems around us.
I realize it's a little different, but what I love about working here, especially with you, I can make a phone call. I could send a text.
Yeah.
Hey, Doc, would you come to this event this weekend and help support Oswego Health?
Yeah.
No questions asked, you're there. I
Right,
find that
absolutely.
to be amazing, right?
Well, I
That's
mean,
awesome.
for a system that's given me so much, I mean, I'm never going to say no. I want to be a part of what grows the system, and I want to do my part to contribute. And you guys have done amazing things for me, so I'm right there for you too.
I appreciate that. So continuing with the question.
Sure.
If a physician were considering practicing here at Oswego Health, what would you tell them?
I mean, kind of what I had just said here is that you're really part of the team. I think we do a great job, especially in primary care. I can speak from that side of it, to integrating people into the team. It's a very friendly atmosphere. It's not competitive. We're all a big family. We're also the single biggest service line that Oswego Health has. And we're always looking to grow that. So we're adding people as often as we can. And I think people just generally fit in here very well. And since the time that I started, I can't think of any loss of primary care providers that we've had. We've only just expanded and grown. So it really is a comfortable place to be. And it really is what you see on the surface. So
We talked about the past,
yeah,
the present.
sure.
So what excites you most about the future in healthcare here at Oswego Health?
Yeah, the big thing is I don't really see how it's limited. Oswego Health has done a great job at being open to any possibilities. Anything that's going to better care for the people in the community is really where they're headed. So I really feel like our future is kind of limitless at this point. They've really done a great job at kind of moving the system forward and doing the absolute best that we can for patients. And we're expanding now. We're moving into the Clay area, and I'm just ecstatic for it. I can't wait to get started.
I know you, but if I'm a new patient,
Mm-hmm.
if I'm going to see Dr. Rogall, what am I going to get? What am I going to expect?
So I really want patients to know that when they come to see me, if they're just establishing care with me, they're getting a partner in their healthcare, and they're getting a teammate. And it's kind of it's a topic that we've talked about a lot here. And that's just not me as part of the system here, but that's me working with patients together as well. I'm not the type that's going to rush in and out of a room. I hope that a patient never feels like I'm not listening or hearing what they're trying to discuss with me. And I'll be the first one to admit there are times where I might be 15 minutes behind, but that's because I'm giving somebody in the morning all of what they need that day. And that doesn't mean that I'm going to take away time from somebody else's appointments. And I'm always going to try and make patients feel like they're included in their healthcare and that they're being heard.
That's the biggest complaint I hear. It's time.
Yeah. And there's a lot of pressures these days with the amount of patients that we have to see in a day, the amount of documentation that's needed, prior authorizations from insurance companies. But those aren't things that the patient can help. So they shouldn't be the ones suffering, and we shouldn't be taking time away from patients to be doing other things.
I remember one story I always heard with EMRs, doctor, computer, eyes down. I had a friend of mine that asked their doctor, "Hey, what's my eye color?" And they had to look up.
Yeah.
They're like, brown. I just always thought that was interesting. Yeah.
Yeah, a computer can be one of the greatest things that helps us deliver quality patient care. It can also be the biggest distraction away from quality patient care as well.
As you know, we asked you to bring in a few items that represent you.
Yep.
I noticed there's a camera.
Yeah.
Tell me more about you and photography.
So this is something that I picked up, I think I was in undergrad. And I'll be the first to admit I have no artistic ability whatsoever. And I admire people who do, because that side of my brain just, I don't know, didn't develop.
You should see me at Paint Your Pet Night.
Yeah. So this is a way for me to actually, let's say, disconnect. If I need downtime or something like that, this pulls me away from everything else that might be a little bit more stressful, overwhelming. If I just need a minute, I go out with this. It's manual focus. I mean, I have to pay attention to what I'm doing with this, and it's just a great way to relax and unwind for the few hours I might need that every now and then.
Now we're going to take you through the rapid fire questions.
All right.
First
So-
thing that comes to mind, just throw out that answer.
Sure.
Are you ready?
Yes.
All right. Hardcourt, clay, or grass?
Hardcourt.
Why?
Because I don't move well.
Great answer. Your best shot, serve, forehand, or backhand?
Serve.
Why?
Because I'm tall and I don't move well.
Favorite vacation spot you've ever taken?
Oh, that's a good question. Napa in 2024 with my now fiance.
Wow. Favorite part of your day in clinic?
First patient of the day. They always set the tone for how the rest of the day is going to go, and everybody's in a good mood in the morning when we first see them.
If you could instantly cure one common health problem, what would it be?
Diabetes.
One word that describes a great primary care physician.
Relatable.
Best advice you ever received in medical training.
One of my attendings in residency always said, if you just listen long enough, the patient will tell you what's wrong.
That's a good one. One myth about healthcare you wish would disappear.
I don't think there's one single myth. I think there's a lot of smaller myths out there with the availability of information these days. I think there's a lot of information that's anecdotal and based off of patient or person experience that might not necessarily translate to everybody. And that while information is great, and I love when patients really take a ownership in their health, we've got to be careful where that information is coming from and really focus more on the evidence-based approaches.
Awesome. We talked about Kingston.
Yeah.
So I want to talk a little bit about CNY.
Okay.
Where's your favorite place to go in Central New York?
Oh, this is going to sound bad, but Nobody's Bar down in Armory Square. It is a small wine bar that focuses on wines that normally don't get the spotlight. The owner and the staff there are absolutely fantastic. If you haven't been, you got to go.
So my gift to you today, Dr. Rogall, is I was able to grill you with questions.
Okay.
So you now have your opportunity to ask me whatever you want to ask.
All right. I've
So
been looking
go ahead
forward
and fire
to this.
away. Yeah.
All right. So when you're not here, you're a firefighter in Onondaga County.
That's correct.
All right. So tell me about one experience that you've had there that has made a big impact on you.
The neat thing about being a volunteer firefighter, that any time outside of work, I'm available, the bell rings, we go. There's an honor in being the person, and I know it's something you can relate to. It's being the person that's there to help on somebody's worst day. Every call, there's not one moment. Every single call is somebody's worst day.
Right.
Being able to help them, there's to me no better feeling, especially when it's a call and there's not many, right? Because it's just the nature of the situation when we're able to make a save, right?
Yeah.
We show up on a cardiac call and the patient's stable when they get to the hospital. Then they come back to us a month later. There's no better feeling than that.
Yeah.
Right?
I can imagine.
Yeah. Plus we get a little lifesaver pin.
There you go.
Yeah.
That's why you're doing it.
That's why. Yeah. But we appreciate having you here today, Dr. Rogall.
Yeah. Thank you for having me. It was a pleasure.
Yeah. Thank you for going off script with us. So this is Oswego Health Off Script. We will see you next time.